Doctors of Reddit, what is a disease that terrifies you, but most people don't care about? Hantavirus. Found in rodent waste and inhaled. Makes you bleed to death before diagnosis. Rabies is nothing to mess around with either. Once symptoms appear, a miserable death is all that's left. At my old apartment we had a rat problem and my mom was super worried because I think one of her relatives had died from hantavirus. Got out of that place as soon as I could and left all the rat shit for the landlord to clean up since he didn't want to hire an exterminator. From what I understand, it's the little particles that get into your lungs. Pretty sure a National Geographic special said that wetting the droplets, like getting some bleach water and spraying it on the droppings, makes it safer to clean up. Someone please correct me if I'm wrong. We have recurrent cases of hantavirus here in Chile every summer. Being a huge thing in the 90s, the recommendations for holidays was always opening the house you rent as soon as you arrive and let it air for some hours. Then clean every surface with bleach and water. Of course you need also to remove the droplets if you find any. The probability of getting hanta from a house is low, but since most of holiday houses were abandoned for the full year, it could be a focus of infection. Doctor here. Strokes. Risk factors include most of the pre-existing condition that nobody seems to care about: hypertension, diabetes, smoking, and once you get a stroke it can be extremely debilitating and life-changing. I have seen people go from "but grandma was fine just a touch of the sugars" to "grandma now can't move, talk, or feed herself." The fact that 1, your life can change from 1 minute to the next, and 2, the fact that you are basically a prison of your own body afterwards is just terrifying to me. There are 2. Locked-in syndrome would be so utterly tedious you'd want to die, especially if it was misdiagnosed as a vegetative state. Severe central pain syndrome is so awful people with it frequently do kill themselves. A colleague of mine treated a woman who was diagnosed with locked-in syndrome. What made it worse is that she, the woman with the syndrome, was a nurse at the hospital she was admitted into. It was just so sad. Being aware of what's going on around you, but unable to move or speak. Reminds of Johnny Got His Gun by Dalton Trumbo. Definitely horrifying. Which reminds me of the video for Metallica's Hsv-1. Used to freak the hell out of me when I was 13, and it came on 120 minutes late at night. Prion disease. Specifically fatal familial insomnia. Imagine one day you can't fall asleep for some reason. Within about 18 months, you'll be dead, and there's absolutely nothing you can do to stop it. My great aunt died of CJD. Death sounded like a mercy compared to how she lived. I had a scare with that. Some kids taking the same treatment as I was were injected with prion-tainted HGH. Soon after I stopped the treatment I received a letter informing me that I might die a horrific death. It really messed with my head for a while. Doctor. Currently in residency. I'd agree with prion diseases that were already mentioned, but a terrifying one that is not as known is Hsv-1 Encephalitis. Caused by the herpes simplex 1 virus, which is incredibly common, mainly known for causing cold sores. Hsv encephalitis affects all age groups and almost always leaves people with significant neurological damage or personality changes. The exact pathogenesis is not known. Although immunosuppression may increase risk, it's rare. But the fact that there is not much of a warning to it, and the fact that it can permanently change your personality and leave you with long-term neurological symptoms even with early treatment with antivirals is terrifying to me, especially with how common Hsv-1 is. I worked with a wonderful doctor who contracted a viral infection that led to encephalitis. They believed it happened after a camping trip from a pest bite of some type. He went from this healthy, intelligent, kind young man of 4 small children to confused, anxious and barely competent. It was the saddest thing to watch. I loved working with him, and he had to quit after multiple attempts to work. Alcoholic hepatitis, acute liver injury from alcohol, and cirrhosis, chronic liver injury. We do not really have any treatment for it beyond steroids that only sometimes help in the acute period and supportive care. Not entirely clear why particular alcohol toxin exposures result in the acute injury, i.e. Some people may be heavy drinkers for a lifetime and have no major acute hepatitis episodes, whereas other people aren't even heavy drinkers and just one bad binge sent them over the edge. Our ICU is often filled with chronic liver cirrhosis patients awaiting transplant, and the vast majority do not make it to that point. Cirrhosis is awful. My husband got diagnosed 3 years ago. He has had varices burst, has to have paracentesis. He only weighs 122 pounds and is 6 feet 1. Med student here. Leechner Syndrome is something I wouldn't wish on anyone. Most people have never even heard of it before. It's an error in purine metabolism. This syndrome has a ton of symptoms and comorbidities, but one of the most shocking is self-mutilation. These babies often eat their own lips, fingers, and hands. They also tend to slam their heads against objects. They often have to be restrained and either have their teeth removed or wear a mouth guard. Older people with the disease often ask to be restrained because they have no control. What makes this disease even worse though is these individuals are not insensitive to pain, so they feel the pain as they, in lack of a better term, eat themselves. Rabies. I read a thread that terrified me. It's a horrid way to go far show. I'm a researcher who goes to countries where rabies is very common, so I've had the rabies vaccine. At first I was kind of ambivalent about getting it until an Australian nurse gave a talking to about when she had to treat someone who'd gotten infected. That sobered me up real quick and changed my mind. What the fuck? I worked for my vet 4 years and we all had to get vaccinated for rabies every year. It was mandatory. Alzheimer's is scary. Not even a doctor. Dementia is secondary. But still, anything affecting the brain ducking is acary. I'll add Huntington's disease to this list. For those who don't know of it, I would say it's Alzheimer's, but you rapidly lose your motor functions as well as your mental up, until you eventually lose control of something important like your ability to swallow or breathe. My grandfather and mother died of it, and I have a 50% chance of having it. Not fun. Shit, you got 13's virus from house. Jesus duck, I'm sorry that you have to deal with that. Legionnaires Disease. It's caused by a bacteria that can form in stagnant water if pipes aren't flushed often enough. When my office reopens, no way am I drinking water from the tap for at least a month. I wonder if we'll see outbreaks of it as businesses and offices reopen. I think I'm gonna avoid drinking any water that isn't from home or a bottle for a while. Then, SIDS is very freaky. Lost my daughter to that this year. We assume they couldn't find a cause of death. Freaky is an understatement. My dude. A serious understatement. We have another on the way and the thought keeps me up at night. Ophthalmologist here. I'm scared to death of retinal detachments. You could have 0 risk factors, be completely young and healthy, and just one day wake up blind. They can come out of absolutely nowhere. As an eye surgeon, if I wake up blind in one eye, I won't be able to operate anymore. There goes years of training and years of school. It's terrifying. By the way, considering the number of people reading this post such as yourself, I wouldn't be surprised if one of you wake up blind tomorrow morning. Sleep tight. Looks like it happens to 1 in 300 people over a lifetime. That's more than I'm comfortable with. Working on my PhD. Does that count? Sudden cardiac arrest. I knew a girl who went from standing and laughing to being dead in less than a few minutes. Autopsy had no official cause of death. 19-year-old. Had been previously healthy. No drugs involved. The thought that despite regular checkups I could go from being totally fine to dead in mere moments sets my panic attacks off majorly. Usually these people have a congenital or inheritable heart condition such as hypertrophic cardiomyopathy or long QT syndrome. Some clues prior to sudden cardiac death include unexplained syncopial episodes, fainting/loss of consciousness, or family history of premature death. Classically in medical textbooks, the relative would have died from drowning, driving, or other activities where losing consciousness could be fatal. If someone experiences this or has that history, they should see a doctor and may need a heart monitor to detect abnormal rhythms. Implantable defibrillators/other interventions can help prevent death in those cases. Not sure if this counts. I'm not a doctor, but my mommy's. In one of her frequent don't do drugs talks, when I was a teenager she told me about Serotonin Syndrome, which sounds scary AF, and can happen apparently if you take ecstasy while on certain antidepressants. ID are the exact details, but it involves a really high fever and ducks up your kidneys. Some people die from it. It's really rare though, and luckily did not happen to me despite having used aforementioned drug combination. I've had to go through a ton of antipsychotics, and the one thing that always comes up is no grapefruit. The reason? Serotonin Syndrome. That scary ass fruit has a chance of putting me into an early grave. Not a doctor, but I was once told by a doctor that no one seems to care about Ebola. Super deadly, super scary, but everyone thinks it's just some random disease that exists in poor countries. Today I learned that there is now a vaccine for Ebola that has proven to be 99% effective at preventing the disease. Pretty cool. Yes, it's between 95 and 100% effective. Ebola has always both terrified and fascinated me, so the fact that there's a vaccine for it now is awesome. If there were a doctor in this thread she would probably say cardiovascular disease, common cause of death, and patients don't care because they won't die for a number of years. Not a doctor, but I work in a hospital with patients with necrotizing fasciitis. Yikes. I have a cat that had NF. That was an expensive treatment, and he was able to keep both limbs. He pretty much lived at the vet for 3 weeks. Not a doctor, but ALS. We have all heard of it. It's the disease Stephen Hawking had, but it's a horrible disease. My brother's father had it, and he lived a little longer than they said he would. At first your speech becomes difficult, sorta like those days when you're tongue-tied and can't predicate your sentences, and it gradually moves to your skeletal muscles. You lose your motor skills over time, and then at some point you'll become wheelchair bound. From there it's just a matter of time until your diaphragm and respiratory system give in. It's a horrible disease and people should really realize that. Edit, illegible word used. My sister's best friend's father has it. Luckily their kids are all adopted, so he doesn't worry about passing it on. But I occasionally go and pick my sister up, and seeing him decline has been really sad to witness. Anaplastic carcinoma of the thyroid. Very invasive tumor. Spreads fast throughout the pharyngeal area. Generally unresectable. You die within months of diagnosis to asphyxiation as it blocks your airways. Worst cancer IMO. MRSA. Super scary. Everyone thinks it's just staph. Not a medical doctor, but deep vein thrombosis gives me the absolute heebie-jeebies. I had a DVT. I went to the doctor and the nurse ducking missed it. Sent me home, and within 48 hours I had full-blown bilateral pulmonary embolisms. I'm very lucky to have survived. If you ever get a cramp in your leg, that flat out will not go away. Absolutely insist on an ultrasound. Me too. Urgent care said it was an infection, and sent me home on antibiotics. 2 days later, no better. Went to my primary who said go to her. It was 4 PM on a Friday, cause I think this is a DVT. And it was. And I got on meds and wore my compression socks, and had follow-up ultrasounds for 4 months. Terrifying. Didn't sleep for like 4 days, because I was scared the clot would dislodge and it'd die. Lyme disease. Very treatable if caught early, but it's hard to diagnose. I've heard it can be mistaken for all sorts of things, which leads to it being diagnosed a bit later. Chronic wasting disease. It's a prion disease that affects deer, and people who have eaten it have it in their system. It's not known to pose any risk to humans, but we said the same thing about mad cow disease. For all we know, CWD could be a ticking time bomb that'll turn us all into zombies in the near or distant future. Not a doctor, but my friend studied this one for a school project. People really underestimate its power. Sickle cell disease. Until you've been in the hospital you don't realize how debilitating it can be. Truly a difficult condition to live with. Not a doctor. I'm terrified of heart attacks. The physical symptoms of my anxiety and very strong and persistent. I can spend days with a numb left face. a vice-like grip on my arm, and the top of my head prickling, like it's on fire. I also have bradycardia problems. Hours. Days. I'm worried one day it's going to be a heart attack and I won't realize it until too late. Have you seen a doctor and gotten a second opinion about those anxiety symptoms? I'm sure you know yourself better than I do, but those are extreme and definitely not the norm for anxiety. Not a doctor, and not a disease, but brain aneurysms. It can happen anywhere at any time. That's what makes it so terrifying. 24 meters here. I'm not a doctor, but I think it should be ALS. My father has ALS. He was diagnosed with ALS 2 years ago. Every day I wake up and see my father one step closer to his death. And the worst part is I can't do anything about it. No one can do anything. We can just wait. Wait till his own body becomes his coffin. Psychological trauma. Financial burdens, because I'm the only earning member in my family. Jeopardize career, because I can't leave my father and move to another city for a better job. I don't know how long can I keep this up. I would not wish ALS even on my worst enemies. I'm 31. There is a disease. I forget what it's called. But it's hereditary mother to son that causes an aneurysm and death. My mother had one in her early 30s. And now I'm the age where it should happen soon. Medical student here. I'm terrified of catching something like HIV that will stop me from being able to work. That or developing something like Parkinson's disease or dementia, where I slowly degenerate and can't stop it. Hey PSSST. Please subscribe and like.